This is Average Joe PT, where we're here to reduce anxiety, improve function, and master your pain. Isn't that right, Skully?
Mastering your disc pain.
That's right, Skully. And today we're going to talk about disc issues. We're going to go over all types of treatments that you can do at home to help reduce that back issue coming from that spinal disc. Now, if you guys are new to the channel, Skully and I would love to have you subscribe down below, hit the bell. We bring content once or twice a week. We do lives on Wednesdays and Sundays. So like Skully and I always say, let's look up and keep smiling. Here we go. Well, this is Dr. So-and-so, and I'm telling you all that this disc right here, you need to have surgery every single time. If you're going to have that pain in that back or pain down that leg, you better have that surgery. Most definitely, every single time, all the time. Well, this is Dr. Cool Cats, and I'm telling you right now, this guy is an absolute moron. Listen to this guy all the time. He thinks everybody needs to have surgery. Are you out of your mind? Have you ever heard of physical therapy, injections, aquatic therapy? There's all types of treatments that can be done besides having surgery, Dr. Know-It-All. So here's Dr. Cool Cats telling you, you gotta listen one more time. Now, whether you're listening to Dr. Know-It-All or so-and-so or Dr. Cool Cats here, there's always two physicians with two different approaches to the exact same problem. You always want to get a second opinion because we always know that two heads are better than one. And I always say, take the more conservative route. Start out with obviously some therapy, maybe some injections, maybe some pool or aquatic therapy before you go underneath the knife. And at that point, there's no going back. So, like I always say, two heads are better than one.
You want to get outside and walk and making sure you're staying away from sitting for long periods of time. Definitely don't want to start sitting like this guy right here. And you definitely want to stand up every once in a while and start to extend that back a little bit like this guy's doing. And you want to make sure if you have a flare-up with their leg symptoms, you want to try and start doing this extension or back exercise where you're lying on your stomach and you're putting that TENS unit right on your back like this guy's doing.
Hey Skully, what do you think about this stuff so far? How do you like this?
I don't mind this, but you got me on the floor
I
again.
know you're on the floor again. It's a beautiful angle like it was last time. Don't be such a hater. You're lucky I had you in this program. I thought about leaving you out because you're so mouthy some of the times. So yeah, we're going to stick these pads. Let's do one channel at a time on one side.
This is
And then
ridiculous.
do the channel on the other side. So you got two leads on one side of your back and two leads on the other side of your back. Pretty simple. A little trick to this is when you're done with these pads, put them in the refrigerator. They'll actually keep the adhesive a lot longer so they don't wear out so quick. And obviously, don't have any lotions or anything on your skin when you're putting these pads on because next thing you know, you've worn the adhesive too soon off. Alright, so I'm turning this up. I'm going to get on my stomach for a little bit. Throw some ice on that baby. And just lie here for a little bit. What do you think, Skully?
Are you done messing around now? I want to get off the floor.
Okay, we're going to get you off the floor in a few seconds. We're almost done.
You always say that and then there's 10 more minutes.
What a pain in the neck you are.
At least you have a neck.
I should have left you upstairs.
I didn't ask to come down here in the first place.
Here's also some other exercises. It's a nice progression that you should be doing when you're trying to get that disc symptom to calm down, that shooting pain down your legs. Take a look at these. tips for this for the back and leg symptoms. If you're having symptoms, lie in your stomach. Put some pills moving to support that back. Throw some ice on that lower back. Trying to make your leg symptoms calm down and stay away from sitting so much. Those themselves, as well as do a little bit of walking. That's also going to help you reduce your nerve symptoms.
Skully and I, we'd love to have you guys go ahead and hit this next video. It's gonna go over all different types of treatments that you can do at home to reduce your chronic pain, specifically in your back. And like always, we'd love to have you subscribe down below, hit the bell, and until next time, we want you to look up and keep smiling. See you next time, folks.